questions for you. We're going to be brief because nobody wants to listen to us talk for very long. What does postpartum depression do to a woman's sex life?
Well, postpartum depression and depression in general sits on one's libido and ability to have an orgasm. It definitely affects one's sexuality in the context of that illness. Depression can cause low mood, and that in turn can lead to sexual dysfunction.
And it's complicated because after pregnancy, many women are not feeling up for sex. I mean, you may have had a vaginal birth and it's sore down there still. Certainly sleep is really compromised postpartum. I mean,
Yes.
this is expected, but
Yes.
we're exhausted.
Yeah.
So there are a variety of things that might affect a woman's sexual function after having a baby.
Right.
But depression itself and its treatment can have some, pretty specific effects on sexual function. How do
Yes.
how do you counsel women who need to be treated for depression with medicine, but who are also worried about their libido,
Sexual
especially?
functioning.
Yeah.
Right. So a lot of people will say, the two things that concern them most when they're depressed and they're thinking about going on a medication, they worry about gaining weight and they worry about sexual functioning. And those are the two biggest offenders. When we use these medications, those are probably the two biggest side effects. And so they're right to worry about it. On the other hand, when you have a moderate to severe depression, or anxiety for that matter, because those are treated with the same types of medications, antidepressant medications, you have an illness that really needs to be treated.
Right.
And I'm not saying we ignore the other, but we go for the treatment. We consider what the side effects may be. We look for them, and then we deal with it if we need to. And hopefully it doesn't happen. It does not happen to everyone.
Right.
So I always talk about it and disclose that these two are the biggest offenders in terms of side effects, but, we're going
Right.
to deal with it if we have to.
I do say to my patients, I'm interested if you think this is right or I need to tweak it a little bit. But I say, look, untreated depression is not good for your sex life.
Right.
Untreated anxiety will make it really difficult to be in the moment, to focus. And that's important for arousal and orgasm. Even though the antidepressants can have some sexual side effects, the alternative of having untreated mood problems, especially postpartum, I think is worse.
Well, what's interesting is that some people are having the symptom of depression or anxiety, which is sexual dysfunction. So when you treat them with an antidepressant, they are actually relieved of the symptom
Right.
and have less sexual dysfunction.
Yeah.
So I've actually seen more of that, which is, it's not that the antidepressant is treating the sexual dysfunction, it's treating the depression and allowing sexual functioning to become normalized again.
Right.
Yeah.
Okay. You have any questions for me?
Well, when I've given someone a medication that does sit on their libido or their ability to have an orgasm, I can find myself in a difficult position, right? Because I need to treat their depression, but I don't want to give them the side effect that is also causing them to feel depressed.
Yeah.
Right? And it may not be, they may still be in a better position, but it's still bothersome.
Right.
So what do you do for that?
Well, thanks for asking.
Yeah.
I think in the very specific population you're caring for, I, as a gynecologist, would think about, are there any physical components to the sexual dysfunction? And postpartum, it's very reasonable.
Right.
If you've had a vaginal birth, were there tears? Was there an episiotomy?
Right.
Are you still recovering and healing? Have there been infections? Are there problems that have physical causes
Right.
and physical solutions?
Right.
And or at the very least, the healing of time is going to resolve, and we could reassure people about that. Pelvic floor problems are another one, and they're very correctable.
Right.
We've talked with pelvic floor physical therapists on Woman Lab. There's another video on that if you're interested. But the carrying a pregnancy and recovering from surgery may trigger or contribute to pelvic floor muscle problems that are very correctable.
Right.
So I like
Hope.
you.
There's a lot of hope.
There is hope.
There's
There is hope.